Big call. To order our December the 15th, 2020 Lynchburg City School Board work session to order. And as we call our meeting to order on tonight, I do want to pause for just a moment, for a brief moment of silence in memory of Mike Harmon. And we would also like to include to that Alfred Jones II, who's a member of the Appomattox School Board, whose wife recently passed. And so please, could we observe a moment of silence for those individuals? Thank you. Our agenda for tonight under section B1, our agenda is in order for approval on tonight, and those individuals in which
we are here because it's an open meeting and we're allowed to be here.
In the lobby.
No, this is an open meeting, we're allowed to be here. And government meetings, they allow us to be here. We're here to watch the meeting.
Hold on a second, ma'am.
We're going to be here. We're no longer allowed to participate in the meeting, and that's why we're here, is that you removed the ability for us to comment in person. This is an open meeting. We are legally allowed to be here. We will simply sit here and we will watch the meeting.
Hold on, man.
This is not a board meeting where we have participation.
We don't have rooms for all of you to be in here and be socially distanced. You can participate and listen in the meeting in the lobby.
Okay.
Let's go into recess.
Yes. Look, the school board, just a brief moment, and we do certainly thank our cooperative citizens for coming tonight, but we do have rules and regulations, and we will observe those this evening. We'll recess for 5 minutes. We'll return to recess for just a moment. And again, I do want to thank the board for the acknowledgement of the moment of silence for the worthy individuals. I do want to acknowledge now, pursuant to the protocols of the school board and the school administration building, that public meetings, work sessions, and our regular meeting are certainly accessible to the public. And we have designated the lobby in view of social distancing. And so at this time, we would like our guests, those from the community who we value tremendously, to have a moment. The live stream is up, and we do apologize for that not being up prior to for seating, because we do not have the social distancing dynamics in this room. And that is for all meetings that we have established. So we're going to reconvene in about 3 minutes. Just give persons an opportunity to do that, and the meeting is very public, and that is pursuant our protocols and our attorneys. And we thank you for your cooperation and for your presence tonight. And so we'll break for just a couple of minutes to give persons an opportunity to do that in the lobby. now recognize that Amy Pugh is with us tonight, our Deputy Superintendent, and Dr. Crystal Edwards, our Superintendent, is with us as well on this evening. I know that there are a lot of thoughts amongst the board members at this particular moment, but we are going to swiftly proceed with what we have to do tonight, and then we will handle ourselves accordingly. At this time, we will have C1. First of all, I have not had the agenda to be approved. Is there a motion to approve the agenda for tonight's meeting?
Move to approve the agenda.
Been moved by Dr. Nillis, second by Ms. Morrison. Any questions or discussion? Hearing none, all those in favor indicate by saying aye.
Aye.
Those opposed, the motion carries. Because of the dynamics for tonight with C1, special education, has been postponed. I want to make that so noted that we will come back to that particular matter. In D, we have in section D for school board committee reports, Mr. Gary Harvey will come forward with our governor's school committee. Mr. Harvey.
Central
Point
Virginia.
of order.
Yes, sir.
We could do the pledge.
We did not do the pledge. And Dr. Nillis, I think that the Pledge of Allegiance would be most appropriate at this point. I'll stand and do that. We pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. A wonderful statement. Thank you, Dr. Nillis. Mr. Harvey.
The Central Virginia Governor's School Governing Board met on Wednesday, December 2nd at 1 p.m. The board covered several items during their meeting, including the following. Dr. Smith presented the financial report for review by the board. Dr. Smith updated the board on COVID-19 related plans and updates as they impact the operations of the Governor's School. The board reviewed its policies and approved several updates and changes to the Central Virginia Governing School Board policies. The board discussed the director's evaluation procedures and will continue these discussions at our next board meeting. Our next board meeting is scheduled for Wednesday, February 3rd at 1 o'clock p.m.
Thank you, Mr. Harvey. Dr. Gupta.
As we talked last time, was there any discussion on providing leftover seats for economically disadvantaged students?
That item was asked to be put on the agenda for further discussion at our next board meeting.
Thank you for that, Dr. Gupta. And Mr. Harvey, I'd like to get with you. I was on a meeting today with Secretary Carney and some of the leadership that's trying to look at inclusivity and equity with the 19 governor's schools in the Commonwealth, and want to weigh in with you to get some thoughts about how we're coming along in our area. So thank you for your service in that regard. Thank you, sir. At this time, under E1, we will have our minutes from the October the 20th, 2020 school board work session. That was pulled from the consent agenda on last meeting because they had not been completed. Barbara always does a fine job with that, but she was sitting for that. And so we have those minutes now. This is an action item. Is there a motion to approve the minutes from the October the 20th, 2020 school board work session?
I move that we approve the agenda from the October 20, 2020 work session.
Thank you, Dr. Carter. Is there a second?
Second.
Second by Ms. Morrison. Any further questions or discussion? Hearing none, all those in favor indicate by saying aye.
Aye.
Those opposed, motion carries. Item E2, the City Task Force on Education. That august body met virtually, and we do want to give a very brief moment to school board members Susan Morrison and Dr. Gupta to just update the board on the direction that is going forward with that group.
As you know, the school board, city school task force we have not had a meeting since March. So we wanted to regroup, and Dr. Edwards and staff were there to share with the members of the task force what changes have occurred And then we decided that we needed to really look at the purpose of what we were doing and how the pandemic has really changed our whole view on where we are going. So it was decided, Dr. Gupta, that we were going to have a steering committee meeting, which would be made up of Dr. Gupta, Gloria Preston, Mike Gillette, Bo Wright, Randy Nelson, and myself. And so we're meeting Monday, I think. I feel that's what they're trying to set up.
December 21st.
Okay. And so then we'll have that meeting, and I'll be able to report back what the steering committee decides, the direction. That's where we are right now. But it was a very good meeting.
Thank you, Ms. Morrison. Dr. Gupta, any additional comments to add?
As she said, and as I said during the meeting, a lot has changed since the task force were formed. We have gone more remote, distance education, the whole environment is completely different. So we need to relook at the different things and then put this together. How should we proceed forward? So they have this tentative date of December 21st for the steering committee to meet.
Thank you, and they will keep us informed. We just wanted the board to be aware of what was moving forward with that group. And now moves us to E3, and I would like the board members to know that Dr. Edwards, with the assistance of Amy Pugh and other persons, will expeditiously move us through item 3, return to learn updates, and our administrative team.
Thank you, Dr. Coleman. Good evening, everyone. And I am participating remotely in accordance with our COVID procedures for LCS. So I'm still here with you and happy to be with you tonight. Under Return to Learn, we have 4 separate items that we want to discuss and with the board and get some guidance and direction. So I may be making a recommendation at the end of the discussion for those items. We may do them separately just for ease of conversation and discussion. The first one is regarding our in-person public comment in response to the community spread of COVID-19. As you recall, our boardroom was set up for having public visitors inside the boardroom with us. We since have extended tables almost to the door to accommodate 6 feet so that the board members could still meet in person and still have social distancing and practice 6 feet, along with just a little bit of space left to have any other people at the podium as they're speaking. But the room really doesn't condition itself for having a crowd. We have been allowing folks to meet in our lobby. That has been our new public comment, our public area to gather. It is a very tiny space that doesn't have a lot of room. And again, we are very concerned about COVID spread. So we would like to make a recommendation that we temporarily limit or suspend in-person public comment and go back to what we had in the spring, which was still very engaging with our public. They emailed us, and Dr. Coleman, Dr. Brennan did a great job of reading all of the comments that were sent in via email, or they left us a message on the phone, which we played so that you could actually hear the person's voice at our meeting. And when I say temporary, I'm just really looking at this time right now and possibly into January's board meeting as we examine the COVID-19 spread within our community. So discussion about that amongst the board.
Again, we are seeking to move right through this. So is there any board member that would like to make a statement regarding this particular matter? And we have other matters, of course, for return to learn. Dr. Gupta.
So my question for Dr. Edwards is, instead of going from January to March, could we go month by month and see how COVID spread is and then make a decision, or do we need to make in a 3-month time at one instance?
We can certainly go month by month. I mean, it's the will of the board. I, am balancing between giving people enough notice so that they can plan accordingly. But month by month is fine. So if we want to revisit this at each board meeting to determine whether or not the future board meeting, we would have public comment, that is certainly appropriate as well. I mean, it all depends on the COVID spread in our community.
It's flexible for us because we really don't know what is before us in regards to that. Any other board member? Ms. Evans?
I don't mind at all having public comment, and I do think it's helpful. I do think just out of basic kindness to your neighbor and respect, if we ask you to wait in the hallway, come in and speak, that should be okay, and that should be acceptable. And, you know, I mean, we don't, not that anybody would spread anything intentionally. I'm taking care of two 75-year-old parents, and we have too many people in this room, not distanced the way we're supposed to be, and I do want to hear from the public. But coming in one at a time is not, to me, any difference in delivering your message than 10 people sitting here. And so I do think public comments are very important. If we can keep it to where people will do what we're asking them to, just the basic protocols, I would love to be able to keep it. If people can't be agreeable to that, then I feel like we have to say no comments, but I don't want to do that. So that's kind of where I am.
Dr. Nellis?
Yeah, my first knowledge of the no in-person public comments was a press release that I saw saying this was a board decision. So I just want to go on the record as saying I had no input on this. I don't consider this a board decision. I don't consider that a board decision was made. And I don't support not having in-person public comments. If we're meeting in person, if we have staff in school, and, you know, up until this week, we were having kids, you know, go to school at least part-time. I understand the concern about the increased caseload. Our experience has been is that's all been brought in from outside. And that the protocols we have in place in the school seem to be effective. And that includes coming in one at a time and making a presentation at the podium. I support that. We're a public body, we're having a public meeting, and the public can come in and make comments. It's, you know, if it turns into a free-for-all, it's just, this isn't the right time to do that. But I do support keeping the current practice as it is. I don't consider that we have changed anything so far because just because a press release went out, there was no formal board decision. So that's where I'm at.
All right. Dr. Sinha?
Yeah, I have to agree with Dr. Nillis. I was certainly surprised to see the press release, wondering if I had missed a discussion, and so that was quite frustrating. And it was unfortunate in that the way it was written did not mention anything about it being temporary, about it being in response to the high caseload. And certainly at the time it came out, we still had students coming to school. And if we can have in-person instruction, certainly we can have in-person comments. I would ask the community, for the sake of my health, the health of my family, the health of my colleagues and their families, and LCS staff, that you respect our accommodations and wait in the lobby. Part of the reason we can't have nice things like in-person classroom is because the community, segments of the community talk about COVID in scare quotes, like it's not real. It's real, people. At any rate, I think there are other ways that we can protect our LCS staff by perhaps, you know, because I know it gets crowded out there. We have people waiting to give presentations. Perhaps they can wait in the wings and come in this door. And we can move the podium over here to keep away from infestation from the community, because that's where it's coming from. We've said this all along.
There will be no comments within, and the law does say that you cannot disrupt the meeting. So there will be no disruption of this public meeting tonight.
Until we have control of community spread, we are not going to have 5-day-a-week, full-day instruction. It's just not going to happen. It's unrealistic to expect that. That said, I do believe that with reasonable accommodations and reasonable cooperation from the community, we can continue to have in-person comments during public comment section of the agenda as long as we are meeting in person in this room.
All right, we have other matters to bring up. This did happen, and I did want to make sure that we pause today for an opportunity to do that. I will be supporting tonight the recommendation from the superintendent for us to have public comments shared temporarily in an abundance of caution, if you will, for our staff. We do have human capacity dynamics going on right now, and so I will be supporting a motion for public comments to be temporarily suspended to email and telephone calls as it relates to our public comments. So at this point, Dr. Edwards, you presented a recommendation, is that correct?
I did, and I have it in my notes, and I'm listening to Dr. Gupta, who asked for a little flexibility with that, with doing it maybe monthly. But before I give my recommendation, I should let the board know and the public know that with regard to meetings within Lynchburg City Schools, I'm talking about my administrative staff, and I'm talking pretty much all things adults. As COVID continued to increase in the community, and we recognize that our staff go home and to the community, including ourselves, one of the things that we did do internally was examine our meeting structure. We did still have some meetings of adults, not children, adult with adult in person, and we have since pulled those back to be Zoom meetings and to try to, reduce the risk of colleague to colleague interaction. So I want to be really clear that this was not generated from the kids, but more colleague to colleague, adult to adult. So wherever we had a director's meeting or a gender prep meeting or principals meeting, those all have been pulled back to be Zoom meetings. So that is part of why we were expressing our concern with our adult colleagues and just really concerned about how small the lobby is and the amount of people that sometimes are in the lobby waiting to come in. We want to respect and protect everybody as far as that's concerned. With regard to the recommendation that I did write down in my notes, I'm going to just read it for the record. The superintendent recommends that the school board temporarily suspend in-person public comments during the school board meetings for the period of, I'll say, January 1st, which will start up the next set of board meetings through January 31st. So we'll just do it for the month of January.
Is there a school board member prepared to entertain a motion in that regard?
I'd like to make a motion that regard to support Dr. Edwards' recommendation.
It's been moved by Dr. Brennan,
Second.
a second by Dr. Carter, that we will temporarily suspend public comments in the manner of January 1 to January 31st. Any unreadiness, Dr. Brennan?
So I just want to comment that I think everyone in this board is supportive of having public comments to the board, and my understanding is that this board's been more encouraging and supportive of that than boards have in the past. I also have to say that this is a very unusual situation that we're dealing with both nationally as well as in our community. We now have a hospital system that is being probably overwhelmed is too strong a term, but it's just moved to 2 new floors to deal with the COVID patients that are coming in so rapidly. Within our school system, we have a program, we have a mitigation plan where everyone who comes in that school is screened by temperature, by questions. There's social distancing, people are wearing masks, it's a controlled environment that's worked very well. And one of the concerns that I have is that we can't provide that level of screening in this situation, in the lobby and people coming in. If we ultimately can do that, where people can be screened, temperature, those things, I'd be more agreeable to it. But this is a problem that's being passed in our community from adult to adult, and it's coming into the schools. We're doing the best we can to keep it out of the schools. We're doing the best we can to protect our staff in the schools, and we want to make sure that the community understands that and can be safe also. So that's why we like to make that recommendation in favor of suspending public.
Further discussion, Dr. Gupta.
So my thing is that this board does respect the First Amendment and the constitutional rights of every citizen to speak, have the transparent meeting, but this proposal is mostly on a health basis because her bandwidth is very limited. And we have seen in recent quarantines that we reached a point where you may not have any staff to take care of our kids. So this contact tracing and quarantine, which you can see people attending through Zoom, has forced this board to go into certain directions which we may not want to go. So,
Any other?
but we do, I'm a supporter of First Amendment. People should be able to speak whenever and wherever they want to.
Thank you, Dr. Gupta. Mr. Harvey.
Yes, I will be voting against this motion tonight simply because I do believe that we can afford the public the right to speak in person if they follow the proper protocols. But based on the example of poor citizenship that I observed this evening, if this issue comes up next month, I will be voting in favor of it. But tonight I will be voting against it. I hope that what the board says tonight will be heard by others and seen as an exemplar for proper citizenship and respect of other people, and they will change their actions for future board meetings. If they do not, I will vote to support all public comments to be in the form of email or voicemail moving forward.
Any other discussion? Dr. Carter.
And I would just like to say that during this time, we do want comments. We appreciate comments. We're not saying not to provide comments, but just in a different way. And you can have it voice recorded if you want to do it through a voice message, or you can have it read like we've done before. But tonight shows me that you're not going to be flexible, that you're going to be a bully and bully us. And that's just not acceptable. It's not acceptable. We have families to go to, and we want to go home and be safe and not carry anything away that we didn't bring here. So I'll be voting against. I'll be voting for the superintendent's recommendation because of the action seen tonight.
Okay. Ms. Day, I'm just going to ask you to just call the roll for this particular vote, please. And before you do so, School Board Member Evans has a statement, and then I also have a statement I'd like to make.
I just had a question. You said till January 31st,
Yes.
January 4th.
Yeah,
Okay.
January 31st. And I do want to echo what I believe some of my colleagues have said. This board, as it is presently configured, has championed public comments and been serious advocates for it, and the increase of it did not start with any particular entity. We have been pushing this and pushing it and pushing it for in-person, as well as allowing other means of creativity. Other school boards around the Commonwealth have been virtual the entire time. This school board has made every effort to be accessible. All 9 members of the school board are present tonight. And so I am standing on my original position. I am supporting the superintendent's recommendation in light of our human capacity needs And I believe that this is in the best interest of our school division and safely affords persons to give public comments, whether they be 3 minutes as an individual or 5 minutes as a group, by way of the telephone or email without interruption. Madam Clerk, could you please call the roll? If you're voting in favor of the recommendation coming from the superintendent, you would say yea or yes. If you are opposed, you would say no or nay.
School Member Evans,
No.
School Board Member Morrison,
Yes.
School Board Member Dr. Carter,
Yes.
School Board Vice Chair Dr. Brennan,
Yes.
School Board Chair Dr. Coleman,
Yes?
School Board Member Dr. Nellis,
No.
School Board Member Dr. Sinha,
No.
School Board Member Dr. Gupta,
Yes.
School Board Member Mr. Harvey.
No.
Please announce the results of the vote.
5 yes, 4 no.
Okay, thank you. Let's proceed with our meeting. Dr. Edwards?
Yes. The next item under the Return to Learn COVID section talks about our protocols for contact tracing, quarantine, and response to positive COVID test. And I put this on the agenda because there was a recent change on December 7th in the CDC guidance that suggested that we can change the quarantine time. So if I'm allowed to share my screen, which I think I am, but I need to find it. So hold on, let me grab that. Okay. Can you see the screen for the VDH protocols? All right, I'm gonna take that as a yes. Okay, I didn't hear anybody. So our current health mitigation plan was based off CDC and VDH. And here is just a short, this is off their site, but this is just a short explanation of, you know, what happens if you have COVID symptoms. You're taking 10 days in a self-isolation or quarantine for safety. And really, that is to protect your colleagues. So that's one reason why I'm home. I was feeling sick, and we have told our staff, if you feel sick, don't come to work. And it's not about you, it's about the colleague that you protect. So because I was feeling sick, I did not come to work last week, and I, am just another member of LCS who has to follow the same protocols that I asked my staff to follow. So in protecting my staff from anything that I did not know, I stayed home, and I am home, but with you, still teleworking, because I care about my staff. So this is the current protocol that we have in place for determining response. Now, recently, and here is where a lot of discussion has happened over the last couple days, because I believe the date was December 7th, that the CDC issued some updated guidance that said you could decrease the quarantine time, but that doesn't come without some degree of risk. So if you're just looking at this household contacts and even non-household contacts, which would be close contact, the recommendation from the CDC is still 14 days. That is still what they have on their website as their main recommendation, should you choose the safest option for quarantine. And I will express it that way. And then what you have are other options that say, well, you can come back within 10 days without testing, or within 7 days if you've had a PCR test or an antigen test. We met with our health director, our COVID response team. We sat down at the time that this guidance was given. We're supposed to consult with VDH, and we did. And at that time, we also looked at the COVID numbers for Lynchburg City, and they were on the rise around December 7th. You all have seen that data, and they were continuing to trend up. So at the time that this information was released, we did make the decision, along with consultation with our health director, that for Lynchburg City, we would like to stay with the 14-day guidance for quarantine. And I know a lot of folks have asked questions about why not the 7 or why not the 10-day, but I did want the board to know that we did do proper protocols and sit down with our health director and have that conversation. And the reason for doing it and staying put, I'll just scroll down a little bit more, is because of the increase in spread that we are seeing right now, and our desire to keep our schools open and really try to minimize that spread. So I guess what I would need from the board, I know this was a topic of conversation, just some guidance as to whether or not we stay put, or would you like us, our COVID response team, to reconvene with the health director, because we do have to consult with the health director to look at our protocols again. But I'm interested in the comments from the board members.
Open for discussion on this matter, and I know many of the board members have discussion. And so why don't we, I see two people's hands up at the same time, which means everybody really wants to weigh in. Let's go ahead, Dr. Brennan, then Dr. Gupta.
So I agree with Dr. Edwards that we should be conservative, which is the way we've approached the epidemic so far with a mitigation plan. I would just ask that this be an ongoing discussion, because I do think that, you know, not only did the CDC approve this, but Virginia Department of Health did, as you just demonstrated. And I do think that this is going to be acceptable over time. And in light of the fact that we're losing staff, we're losing students because of the 14-day quarantine, I think if we could save some time on that, would be a good idea. So I certainly agree with the superintendent and administration at the current time. I just ask that as time goes on, we continue to look at it to see whether it may not be more beneficial in the future to review it. Thank you.
Dr. Gupta.
See, and I'm looking at it from a parent perspective. If I look at it, it's like a swing. We go into hybrid learning to remote learning, and I don't know where my child will be 1 week or 2 weeks from now. So whatever policy we have should incorporate all those plans in mind and inform that to the parents, because I've heard from several of them it's becomes very difficult to manage, child care when we go remote. And I know this was essential because we didn't have the bandwidth to continue going. But going forward, whichever policy you follow should have a more than a week or 2 week plan in place. And the parents should know why are we doing it and where are we heading for, because ultimately we like to bring all these kids back to classroom. That's where they belong and that's where they should be.
Dr. Edwards, just for the community's clarification, this is admin related. Is it a procedure? The school board doesn't have a policy or regulation on this, correct?
No, what the school board did was approve our health mitigation plan, which was submitted to VDOE when we first started the COVID. And part of that health mitigation plan, it talks about our consultation with VDH and, we call it our COVID response team, our CRT, and having those constant conversations about looking at your community and making decisions. We can't do it without the health director, and we so appreciate Dr. Gately for, as soon as we call, he answers and gives us guidance. So it is an administrative thing that we're doing right now. And we do, to Dr. Brennan's point, we do meet regularly. As a matter of fact, I met with Dr. Gately. We had our Tuesday meeting. Every Tuesday we meet, and I know that my COVID response team also has a separate meeting with him that is Lynchburg specific.
Further discussion on this matter? Ms. Morrison.
If we did make any changes to the quarantine time or any of that, would it have to be resubmitted to the mitigation plan, have to be resubmitted?
So any changes that you may recommend, we still have to go back to our health director and say this is what we're proposing and get his consult and some buy-in, and then we can update any changes in our health mitigation plan as needed. But I don't want to leave out the part that, as per guidance from VDOE, VDH, that schools are supposed to be in consultation with their local health directors.
Dr. Carter?
And I know recently the VDH also has ceased contacting people that may have been in contact with the person that's positive. So what are we doing with that? Have we stopped doing that, or are we continuing to do that?
So you are correct in that one of the things that we're noticing across just the United States, I would say, but particularly here in Virginia, is that contact tracing and the personnel parts of that is intense. And the VDH, like many other places, have been overwhelmed with the number of follow-up phone calls and just following and notifying folks. So they have put in certain restrictions in terms of reporting and contact tracing. Now, we do our own contact tracing, and we have not changed our protocols. We will still continue to call every staff member, every student, every person who may have been in contact with someone who is a suspected positive. So we have no plans right now to lessen what we're doing, because again, we're trying to make sure we do due diligence to keep our options for in-person learning open and reduce the spread by addressing it as quickly as possible.
Ms. Evans?
I would just say, I think that we leave it as is until at least our community numbers are down, and then we can re-look at it once we feel like we're back to a manageable time, number. That's just
Thank you, Ms. Evans. Mr. Harvey?
I agree. I think that based on the continued rise in our community, it is best for us to sort of stay the course that we have already outlined. But I do believe that this would be an excellent time to utilize this time to develop a procedure, reviewing the latest CDC guidelines, and developing that procedure to have it in place so that this board could vote upon it at the proper time when our numbers in the community are lower.
Thank you, Mr. Harvey. Anyone else who has not spoken? Dr. Nilles?
Yeah, I would like to see us go to 10 days. If that's the direction the CDC and VDOH are going. I mean, I think it must be based on their experience and looking at when people are come in contact and when they show positive test results, and even if they're showing positive, are they really contagious after 14 days? I mean, this is dynamic. They're learning more and more about this as time goes on. I understand 14 days seems conservative, but it's not making any difference with the increase in COVID. I mean, that's been the standard protocol, and you see where we're at. I guess I would assume with Dr. Gately, there's evidence that indicate that 14 days is excessive, and I know from work experience that is a real burden. So, if the medical community professionals are comfortable with 10 days, I think we should seriously consider it and move toward it.
Thank you, Dr. Nilles. Has anyone else that has not spoken like to share on this matter? Because we're moving right through the agenda very nicely. I do want to reiterate, as we all know this, all views of the board are valuable. So every view is meaningful to us being able to continue in the right direction. And so, Dr. Edwards, apparently that rests with you, and I think I'm hearing from this board that move forward, but to continue to work to move that number down as the numbers would so indicate.
Absolutely. And to Mr. Harvey's point, in terms of a process, we do a weekly review of our COVID response protocols, and that's part of our consult with our health director and our internal teams as well. That will continue, and I can speak on behalf of the CRT team. if we can reduce it safely and have less people that we have to contact and less man hours that we have to spend monitoring this, I think my CRT team would absolutely love to do that. And that is the direction that we're moving in. But again, just trying to strike that balance between, protecting our staff and our students while also understanding the challenges of what a 14-day quarantine does for families and staff as well. So we will continue to be in consult with Dr. Gately, and we'll just keep you regularly informed. And as soon as we can make some changes, we will.
Dr. Edwards, the next item.
Okay, so our next item is a little bit more challenging in terms of we want to look at the status of remote and hybrid learning. And I'll tell you what's slightly different about this than where we were yesterday when we had to call the emergency meeting. And again, I've shared the metrics with you with regard to city metrics and internal metrics and the capacity to safely transport and supervise children. But this conversation is a little different. So I want to take you back in time before Thanksgiving. And I know from the college level, there was a lot of conversation about once the college students leave for Thanksgiving, they're not coming back until I would say mid-January. And many of the colleges went that way. And our team vetted that and we thought through that, and our gut and our mission is really to try our best to keep in-person learning going. So prior to Thanksgiving, I would be remiss if I did not say my community did email me and inquire as to why I was not having a discussion about closing schools after Thanksgiving. There was some concern about people traveling and the like. And at that point, I had no data to suggest that there would be an increased risk, although we were predicting it. But we really weighed that against keeping kids in school as long as we possibly could. So we have since, and again, I'm going to try to share my screen with you just real quick here. Okay, we have since seen the impact since Thanksgiving, both in the city and in our schools. So we are once again at that pivotal point where we have a conversation. So if you recall, this is one of my internal charts that gets updated every single day. And for those who watched the video, I got a lot of comments that it's not updated. The Loom video was done on, I think 2 Thursdays ago. So you're only seeing the data for the day that I did the video. However, the video was just to be instructive so that you would understand what data was being used and looked at. So on this chart, you can see, we left for Thanksgiving break about November 24th. And it so happened on that day we had 0 cases. And even though the COVID numbers in our community were 411 per 100,000, our positivity rate was at 8. And the percent change for the 7-day spread was also pretty high. And then over the next days, and I must remind everybody, our chart is not consecutive days, but school reporting days. If you look at the next several days and, into about 2 weeks following Thanksgiving, we did see a spike in our numbers start to go up. Our average peaked up as of yesterday. It was 4.0 cases for the average of 5-day cases when you look at the previous 5 days. We also saw an increase in the city. So some of the same people who were very concerned and like we do, we like public comment. I take email and questions all the time, who questioned whether or not we would close and shift to remote learning for the Thanksgiving break are asking that about the holiday break. We do not have any mandated plans that say staff cannot travel or, and must stay in the Commonwealth or in Lynchburg City schools, nor do we have anything in place that regulates who can come to your homes during the holiday break or any kind of social gathering. And we do not want to get in the business of that as LCS. That is not our business. But what I wanted to discuss with the board tonight is that now that we have seen what may be a spike for for coming off of Thanksgiving, we are now at that juncture where we need to make some decisions about what does return to learn look like for the first 2 weeks of January, and whether or not the board is at the point of considering having remote learning for those first 2 weeks, joining our college friends, I would say, in terms of trying to manage the spread when we come back to school. So I do want to open it up just to get the board's thoughts on that. Like I said, the community has shared thoughts with me, but we have not had a conversation with the board.
Dr. Edwards, I want to be clear before we open the floor for this discussion. What exactly are you asking us to discuss?
Okie dokie. So I have on the table a recommendation for us to stay in remote learning. We're already in remote learning for the rest of this week. Then the children go on holiday break. When we come back from January 4th, for the first 2 weeks in January, which is the close of the second marking period, to continue to stay in remote learning in response to a predicted spike that we may see after the holiday break. So that is the discussion, that whether or not we are scheduled to come back to hybrid instruction on January 4th. And I would be remiss if we did not have that conversation about the concern around the holiday and what may happen 2 weeks after returning from the holiday based on what just happened 2 weeks after Thanksgiving.
Okay, the floor is open for discussion.
Can I ask a question?
Sure you can. Evan.
Just looking at my calendar in January and December, because I totally understand that fear of coming back in January. I have it too. That's a real worry, whether we want them in hybrid or all day, that's a real worry. But looking at when Christmas is, I feel like saying off the bat to the 18th is a long time. I mean, is that set in stone? Can we say we can look at it for the 11th? That's 2 weeks after Christmas. That gives us 2 weeks to look at data. I'm just wondering if it's got to be as far out as the 18th when we look when Christmas was. And if people are traveling, most people have to be back to work after Christmas. But I don't know, just a thought.
Dr. Edwards, before you respond, Dr. Sinha, is your statement to the bill?
Yeah, I just want to comment that we have to consider social gatherings for the New Year's Eve and New Year's Day.
Okay.
So I see your point in starting that 14 to,
Right.
14-day period after the 25th, but I really think the more prudent way is to start counting after January 1st.
Dr. Edwards, if you would respond.
Absolutely. So thank you, Dr. Sinha, because that was part of what I was going to say, that in considering this, we looked at, when the holidays fell, and we recognized that while, everyone does not celebrate Christmas, so we want to be careful to not coat this with a one-size-fits-all. There's also Kwanzaa. People are celebrating Hanukkah right now. So we did not want to isolate it to that one event. We looked at this more as a holiday break, and that with children being out of school, that it is an opportunity for families to travel, families to gather without children missing school. In addition to also, as Dr. Sinha mentioned, including the January 1st festivities that may go on as well.
Okay, other questions, discussion on this matter? And remember from yesterday's meeting, we all were in agreement we needed to discuss this tonight for further direction going forward. Dr. Gupta?
See, my fear is these events and functions and celebrations will keep going on as part of our life. So will we ever be able to go back to school the way we used to? Could we, just like we did an emergency meeting yesterday, could we call a meeting in the last week of December and instead of predicting, see the actual experience and see where are we going? Because it again puts a burden on parents. As I said, it is that swing going back and forth is not good.
Before I get to Ms. Morrison, of course, anyone else can share their thoughts. But to my knowledge, the board policy can be implemented at any point that either the chair or two board members would like to have a special meeting. So that's that. Ms. Morrison?
Dr. Coleman, may I respond to Dr. Gupta, if that's okay?
Yes.
Yes.
Oh, okay, I can see myself. I could not see you all. So Dr. Gupta, you bring up an excellent point. And yesterday when we were considering the impact of whether or not to go to remote learning for the rest of this week, that was a tough decision because it was the day before and it gave parents less than 24 hours notice. And if I understood correctly, even yesterday we talked about the need of parents need to plan. These are trying times for everyone, but families, I should say, need to plan. So if we were having plans for remote learning, and this is where I struggle, which is why I'm so glad to have an excellent board to help with these kinds of discussions. But if we were considering plans to be remote after the holiday, is it better that families know now and they can plan accordingly? Or do we wait until, we get back on January 4th or somewhere? We have a finance committee meeting on January 5th. We could easily make that a board meeting and make that decision at that time. And quite honestly, I struggle with both. There's merit in both. If we wait, we'll have some data. We'll be able to monitor the spread of COVID. We'll be able to see what's going on in our cities. I think we are going to try our best to continue to do contact tracing. And even though we're on break, we'll figure out how to do that internally. But we may be giving parents a very last minute notice should we make that decision again. And if we do it now while we're giving them notice, we don't have the data. So I'm very appreciative of this board taking that into consideration and having that conversation tonight.
Dr. Edwards said what I was going to say, that I think parents need to know to make plans, to do it at the day before, or the 2 days before, really not giving parents or grandparents or guardians time to make arrangements. And it goes that way if we go back to hybrid, because you've got to make plans to get your children to school. I think we can't wait until then.
Ms. Evans?
I agree. I think it makes it hard. I am very hesitant to say till the 18th. I just am. It's a long time. I am much more inclined to give it one more week than what we already have and say our plan is to go back to hybrid the week of the 9th. We're not guaranteeing you that's what we're doing. We're going to look at the numbers that at the beginning of January and see. And I think we strongly need to encourage families not to travel, we're talking about families will travel and do this. I just think we need to remind everybody that we need to take these next couple of weeks and try to contain this virus in our city and get kids back in school. That is the goal. That's what we want to do. So part of me is very hesitant to say all the way until the 18th. I'm looking at,
15th.
no, that's right.
18th.
The 18th is a Monday. I'm much more inclined to say, let's have a goal of the week of the 11th. Not set in stone, but at least look at the numbers. And we know what's unacceptable community spread, and we can, at least parents would know a week ahead, and it would just be one more week, hopefully. But I hesitate to say all the way till the 18th. That's a long time.
Thank you. Dr. Carter?
Well, I just looking around, listening, and just in the news, and just how people are interacting and going against what is best practices, I think we're going to be in the same situation after the Christmas holiday or the Kwanzaa or the Hanukkah, and also the New Year's parties. We're just seeing that people are not being responsible, that they're not taking this seriously, or they're tired, or they're having different precedents or different values, and I don't see where it's going to get better for especially the holidays. It may even get worse. So I'm for going back, like right at the 18th. I think we're going to have to do that. And I keep hearing parents want to know before time so they can plan. And so we're giving them plenty of time. And I hate this, but it doesn't look like it's getting any better.
I know that others probably want to communicate also or discuss, Dr. Edwards, but I just want to make sure, Mr. Harvey, yesterday you had mentioned language about a holistic plan. And Dr. Edwards, you may have already answered that or have a plan for that, but I just wanted to make sure. Has that been addressed, Mr. Harvey?
Yeah, I believe so. As I hear the other members of the board speak, I agree. I think we need to have something that's clear, and this is the holistic plan that I was talking about, to share with parents so that they can plan accordingly. I would agree that I think we could look at a first week into January date in lieu of waiting to the end of the marking period. But to me, and this is going to be where my question is to Dr. Edwards, I hear, we need the data from our community to make this decision. But I'm thinking more from a practical standpoint. The reason why we had an emergency meeting yesterday was because we had a staffing issue. So are we going to be looking at that being solved by the 11th, I believe?
That's a good
is that
question.
January 11th? I think that's the data that we need to be able to look at. We need to be able to look at, do we have the ability to safely bring our learners and our staff back into our school from the standpoint of our COVID numbers from the community, but also, do we have the staff in our schools and in our transportation and in our nutrition services to be able to operate the schools safely and be able to provide for our learners completely? That's, to me, that's the critical piece that we need to be looking at.
Dr. Edwards, if you could respond to this capacity issue?
Certainly. Thank you for that, bringing that up, Mr. Harvey, because that is a very good question. And I would say that we have, since we've been back in in-person learning, save the last week, it has just been a real trying week. We have not had to close school, and we have quarantined folks and students, and we've quarantined quite a few students since being back in in-person learning, and we've made it work throughout our buildings. And I'm so appreciative of our staff because they have been covering where they could, and and that's everyone. Kudos to the teachers, but the assistants and everyone else in the building have been covering. I think where we are, at least at this juncture, is we had a trifecta effect happen right after Thanksgiving, and we also had the unfortunate passing of one of our staff members who happened to be in transportation. So that caused a very trying situation. Now, we were there with Heritage as well. You remember, we got to a critical staffing point with Heritage. But our goal is, if you look long-term in terms of our strategy, that's our last option. I mean, we don't pull that card lightly because it is a very difficult thing to manage, and which is why we try to keep our staff as healthy as possible, which is why I said, let's pull back from all adult to adult meetings. I mean, if I could reduce the risk to my staff so that they can be there safely for the children, we need to do that. So a couple things with regard to the long term of this, getting through this winter holiday break is probably the last big, I would say, family community gathering type holiday for a bit. I'm not so concerned about Valentine's Day or any other day that's coming up. And I'm very hopeful by the time we get to spring break, we'll either have some turn in our COVID numbers, some more news about vaccines and possibilities there. So we won't have these holiday situations there. That being said, I do think that while I'm grateful for the board to be here tonight to have this decision to be proactive, I do think we need to have time at our board meetings to constantly reassess and project out. And I would probably feel comfortable with about 3 weeks out. 2 to 3 weeks out is about as comfortable as I could feel. Anything longer than that makes it a little bit more difficult, but we're willing to try. So if the board would commit to really reevaluating this regularly so that we can give families advance notice. The individual building staffing issues are taken care of at the individual building levels. The biggest one is transportation. And if I have a moment to just talk about that, because we have really been problem solving about that. And we have really been reflective about our model. When we first we're moving to in-person learning, and we recognized that we had a 22 seat limit. We did everything possible, geography, changing schedules, bus routes, so that we could maximize seats on our bus to get kids to school, even if it meant it turned our existing transportation model topsy-turvy, because we strongly felt that transportation, that was the most limiting factor, even more so than some of the other factors. And when we consider our menu of options for transportation, and we have a very lovely menu, in addition to just transporting zone students who live in the neighborhood near their schools, we have multiple schools that have neighborhoods that aren't near them, that we have to go and pick up and bring to a different school. We also have Schools for Innovation at 3 of our schools, and we pick up kids all over the city to take them to those 3 schools. We have a Go Center. We have division-wide programs. We have the private day schools that we have to transport kids to Rivermont, New Vistas, for example. We work with the Gov School and CVC to make sure that we get kids there. And even we did it to ourselves. We love offering programs, our CTE programs at the high school, but we have to transport kids between the 2 high schools to make sure that they have options to that. We have babysitter hardship for our families who can't get their kids to their zone school. They need to go to a different school. And then we added to that the sibling cohorts. We tried to put all the siblings in the same cohort, and in some cases across multiple schools to do that. And then finally, we just had families that reached out to us and said, my work schedule, I need to be in cohort B. Please try to make that happen. And our model was really, let's just try to get the transportation piece first. Now what we're doing as we're going into second semester, the goal is to fill every seat in every classroom and to maximize that. And in some instances, that is totally counterintuitive to our transportation plan, because right now we have cohorts that they didn't split equally in cohort A and cohort B for some neighborhoods. So we are revamping our transportation model and for second semester, because our primary focus is to get kids in class. So I say that to say, if you see the buses that they're not 22 kids on a bus, I say give us a little grace with that, because that bus may be traveling for 30 minutes. If we put 22 kids on the bus, that bus may be traveling for upwards to 47 minutes, 50 minutes, just because we got more kids that we have to pick up, transport. And as we revisit this, because we think it is the right thing to do, again, I'm asking that the community give us just a little bit of grace, because it's very hard to manage the wish of, please put all my kids in the same cohort, which we want to do, without changing maybe one bus route, which impacts the time that a kid might have been picked up. Maybe you were picked up at 8:15. Now your new pickup is 8:25. So we have a lot of things that are the ripple effect. We don't want kids traveling on buses for long periods of time. So if the buses are a little lighter, but the ride is manageable because of COVID, just being in that confined space. And that's 3 feet apart, even though we have the windows open. So we're balancing a little bit of inefficiency when you see buses traveling versus trying to get as many kids in for the second marking period as possible. The other thing that I need to mention about our transportation is what we're doing right now. When we created our first semester transportation roster, we reached out to families and asked them what their preferences were. We tried to meet as many of those preferences as we could. And then we noticed that we did have some folks who said they needed bus transportation, but they don't use it, and we didn't give away their seat. We also have some folks who need bus transportation, but maybe they're only using it in the afternoon, that the parent feels more comfortable or caregiver feels more comfortable to bring the students in the morning as a car rider rather than riding the bus. The other thing that we noticed is, particularly as COVID numbers started to increase, some families decided that they felt safer if they brought their kids to school. So our numbers on our buses change, but what we're doing is almost like budget to actuals, except it's looking at our bus roster and our ride roster. So who's slated to be on the bus and who's actually riding the bus on a regular basis. And then from there, how can we get those spaces to bring kids in for the second semester? And have conversations with families about whether or not they're using this bus transportation. So I'm giving fair warning to community that for second semester, to bring more students back, because that is our goal, we may have to tinker with transportation a little bit. We may have to upset some schedules, some routes. We may collapse some bus routes for efficiency so that we can free up a bus to get more kids in. And we will do that with as much notice as possible that we can give to families. So I know, Mr. Harvey, you had asked about some of the long range plans of what we're trying to do. My hope is once we get the kids back in January for in-person learning, that we do not have to go remote only. And that we will get, we'll get our transportation pieces to be more effective, and we'll also get the COVID numbers down in the community.
Dr. Brennan?
If I could just comment on the time period that Dr. Edwards is suggesting, I want to precede the comments by saying that I am totally in favor of keeping the schools open as long as we can, because I think that's the real benefit to our children that we all know, and they lose so much when they're not. So my goal, like I'm sure all members of the board, is to keep the schools open. Unfortunately, I think as far as the numbers in the near future goes, that the numbers were going up before Thanksgiving, and the trend of this epidemic has not been sort of a rapid up and down type phenomenon. It's been a pretty much up and then plateauing and maybe slowly coming down. But I think we'll be very lucky to see any significant change in the numbers by January 19th. I think, this is probably going to be a situation we're talking about 3 or 4 months to see changes in the numbers. And I personally think that the board and administration need to think in longer term in the future is what are we going to do if the numbers stay the same? Because I really think that we should be able to figure out a way to keep the schools open, even if the numbers are high, because the schools are safe, the children are safe, the staff is safe. That's the goal. But I think we may have to start dealing with that issue because of the trend of the numbers in the future. So I wish there'd be a change in the next 2 weeks or 3 weeks, but I just think it's going to take longer than that. And I think we may have to start dealing with these numbers staying up for a while, and how do we keep the schools open? How do we keep everybody safe and allow the students who need to come? Some students don't need to come. Some students are doing okay at home, but there's a significant percentage that do need to come. We want to be able to offer those services for the rest of the year.
Dr. Gupta?
I wanted to ask Dr. Edwards, so based on her data, most of this transmission is from adult to adult. There is no transmission between students or from student to the teacher or student to the staff.
So in our schools, we have not, and I'm knocking on all kinds of wood because I don't want to see it. We have not seen in-school transmission, from student to student or from staff member to staff member, save, a staff that live together. You may see it there. But for the most part, even though we may have 6 cases, they're isolated cases, and those cases are causing the quarantine. So when you look at safety from that perspective, yes, it does feel safe. But I will say the reason why we don't have a high number in that regard is my staff is phenomenal at wearing masks all day and social distancing and practicing safe hand washing, and we take temperature as soon as we come in the building, and everything is sterilized and wiped down, and we've got lines on the floor so kids can walk safely, social distancing. We are working so hard in the schools to really keep the schools open. So it is very challenging for us when, as a result of something that happened on the outside, in the community, that it comes into the school and we have to deal.
Nillis.
Yeah, I appreciate everything Dr. Edwards has said. I think it points out the extremely complicated and dynamic set of circumstances that the school division and the staff are having to deal with and react to every day. I voted to approve the going to virtual learning this week, and I made a statement that was conditioned on going back to school on January 4th. I'm going to stick to that. I think it's clear that the division has an effective mitigation plan. We may have to shut a school down because of outside COVID being brought in. The schools aren't centers of transmission. That's not just unique to Lynchburg. That's pretty much a statement that you can make nationwide. Students are screened when they come in. If students get sick because of Christmas, holiday gatherings, then they need to stay home. Staffing is the issue for the division, from what I can tell, and so my plea to the staff is, please, socially distance. You're gonna not be able to go and go hug the relatives that you haven't seen for 6 months or a year. It's just, that's the situation, and we need you here, and the kids need you. The kids that need it are the ones that need to be in school, and remote learning doesn't work for them. I mean, we see that with the student engagement, with the participation, the attendance. They need to be in school. And so we all are enjoying, FedEx and the Postal Service dropping off packages every day. And we can go to Kroger, and we don't have to worry about not being able to get in. I mean, so my position, this is our job. This is critical for these students. We all need to follow the mask protocol. I'm not trying to minimize COVID at all. It's, for a lot of people, it's not that serious, but for some people, it's deadly. And you just don't know. I mean, it's particularly risky for the elderly with comorbidities, but I know of people that are in their early 40s in fantastic shape, and they are having long-term consequences. So this is serious. There's no solution here. There are only trade-offs. And I think it's clear from our experience that the division has effective protocols. There's going to be some risk, and life is not without some risk. That's the way it is. We're doing what we can. We're being conservative, and I think our challenge is going to be keeping the buildings open. But it's the outside COVID. It's not the COVID in the schools being transmitted among students. That's a concern. So I think I support going starting back on January 4th, and I won't support any other option. Thank you.
I do want to say, Dr. Nillis, you raised some very good points, and we do want the public to continue to realize that this board is not naive to some of the layering of the challenges that we have in the most professional way possible. We're trying to address them, and we know that our administration is addressing them. Thank you for your comments. Let's go with Mr. Harvey and then Dr. Gupta.
Yeah, what I hear Dr. Edwards say is that to process the data and the information, she needs a minimum of 3 weeks. So I think that we need to afford her and her staff that benefit and that luxury of being able to make a educated decision based on data. To me, this still goes back, and I agree with Dr. Brennan and I agree with Dr. Nilles, but to me this goes back to the question of the numbers dealing with staff. Again, yesterday our emergency meeting was called because we had 6 out of 7 of our staff in transportation administration out, and therefore we could not transport learners to school. So that's my question. Will we be able to have accurate numbers dealing with staff, dealing with transportation, dealing with nutrition, to be able to make this call to, return to in-person learning? And I, at this point, I don't know that. I don't know that we would have that information in a timely manner to make that decision.
We are putting contact tracing protocol in place in our departments and other locations and schools for the winter break. So we are working on that. I had a conversation today with Director LaTanya Brown and Ann Von Gentry in that Student Services Department. We have a plan in place that we're going to work on tomorrow and share that with the department directors as well as the school principals for a protocol for being notified by their staff for us to be able to contact trace over the winter break, so that we have some numbers, preliminary numbers, and can know who needs to stay at home and be quarantined or not come in because of a positive result in terms of staffing on January the 4th. So we will have numbers. If our staff follow what we're asking them to do, we will have those numbers.
On January 4th?
Yes. We have a plan in place for us to be able to contact trace and at least know, or not contact trace, but at least know who, let's say I become ill over the break, there will be a protocol in place for me to let my supervisor know that I either have symptoms or I've tested positive or I've been in direct contact with someone who was positive. They can share that information and we will know based on the date, then I shouldn't return to work on January the 4th. So we will have those numbers.
Thank you, Deputy Superintendent Pugh. Dr. Gupta.
So yesterday I voted for remote because we were in a tight corner where we had no staffing to take care of kids. But now administration has time to plan out for January 4th opening. So I agree with Dr. Nellis. I'm not going to support any motion other than opening on January 4th, because if I have a 12, 13-year-old kid, I say, why I'm being punished from not enjoying my time with my peers and with my teachers when I'm not responsible for spreading any virus, period. And the other fear I have, as I have said previously, that we already been 1 year into this remote, no remote, and we may have a lost generation of these kids who have not experienced school. And that achievement gap will widen going forward, and it especially affects the economically disadvantaged kids, irrespective of their race. So I will not support any motion, just like Dr. Nellis said.
Thank you, Dr. Gupta. Mr. Harvey.
Just a point of clarification. So January 4th is when you would have the information, the data based on staff, correct? January 4th.
Yes, our preliminary plan would be, as I stated, that if a staff member, let's say at a school, at East Glass High School, the staff member, if they're experiencing symptoms, COVID-like symptoms, or sick, or have been in direct contact with someone who is positive, or they themselves have tested positive, that they would reach out to their immediate supervisor to let them know, and we would keep record of that so that we would know Well, based on the time frame that I reported it, the 10-day, the 14-day that we decided to stick with, I'm okay to come back on January the 4th. But if my symptoms start on January 31st, or if I receive a positive test on January 31st and I notify my supervisor, then I would not be able to come back on January the 4th.
Okay.
So if our staff follow what we're asking them to do, then we should have adequate numbers of who should be in quarantine or who should be in isolation for January the 4th.
So, again, what I'm asking is, we have the information that we need to make a decision on January 4th.
We should.
Okay, so my question would be, if we wait till January 4th to make a decision, and what I'm hearing some board members suggest is that we return to school on January 4th, how does that work with what we've said about giving parents plenty of time to process this?
All right, Mr. Harvey has put a very good point. We don't want to contradict ourselves, I don't think, but have that in the back of your minds as we're bringing this conversation on in. That point is in all of our minds right now, Mr. Harvey, so we're not going to leave it. Ms. Evans, did you want to say anything?
Well, I was just going to say, I think your whole point is not will the information be available January 4th, is that enough time for you to act on that information? And to me, that answer is no.
Not to make a timely decision. So if we're going to, if we're going to look at our numbers, if we're going to do it based on our current numbers and the percentage of staff that we would have in school, let's say on January the 5th, because the 4th would be a remote day if that's the Monday.
That's correct, it's a Monday.
Then we would have to make that decision just like we did yesterday and make that as a one-day turnaround and notify parents that we're going to remain in phase 2 remote only.
That's really hard on parents.
That is very hard on parents. So
May I interject something?
Edwards?
Yes, thank you, Dr. Coleman. With regard to Mr. Harvey's question about the data doesn't stop. So I think people really need to understand how we collect data. We collect data at 9 p.m. on Tuesday night when that staff member calls us. We collect it on Saturday morning. We collect it after church on Sunday. We collect it when schools open, when schools close. Staff typically will reach out to via email or phone or text their immediate supervisors who reach out to us. So there have been plenty of times this year where it's been a Saturday and I'm on the phone with Director Brown and she's giving me an assessment of here's where we are at EC Glass right now. Or I'll be on the phone with her and she's saying, here's what happened at a private school and we have kids in the neighborhood play with the kids in the private school. That data does not stop. So I don't want you to think that, we shut down a little bit with it. The decision-making parts of it are ongoing. Now, when we got to, let's take Heritage Elementary, we saw it trending up where it was, we need to call a meeting where, if you go by color codes, we're at staff orange, about to go staff red if we have a couple more people. And I'm going to give a shout out to the CRT team because they will say, if we're good, because I have this person coming back and this person coming back. So I got 5 more people coming off of quarantine, coming back in, so that if these 4 who we're waiting for, if they have to go out, we're at a +1. I mean, they're doing that kind of math all the time. And we did that in transportation a couple of times before we got to critical. So as far as the staff that actually monitors it as it goes, I feel confident in their abilities to do that. We definitely need our staff to continue to report to us and their immediate supervisors and let us know. The other thing that I do want to mention, and I would be remiss if anyone thought that our staff were out in the community and being reckless or not being safe. There are 5 people that live in my home and I love them all. But if my child tested positive or if my 70 some odd year mother tested positive and I'm around her, I might be quarantined and I wasn't doing anything wrong and I wasn't out and I didn't travel. So I do know that staff are being affected by that as they try to take care of their own households and families. Some of them have children and their children have been quarantined from their own schools and they have to stay home with them. So I don't want this community to walk away from this discussion thinking that our staff are out just traveling and being reckless. It's not that. It's a combination of just living with COVID right now.
Go ahead, Dr. Carter, I'm sorry.
Well, how could we use the information, the January the 4th through the 15th, have that date, and with the information we receive regarding staffing and the drivers and then the school nutrition, then say, have a green light that yes, we do have enough staff and coverage, or no, we don't, and proceed with that way. So just in case we can save those dates. But the other thing is, are people reporting? Do people report?
Oh, absolutely.
Okay.
Absolutely.
Yes, they do. They report all the time. They call, they ask for guidance. They are following I'm sick. They're telling on themselves. They're doing what we have asked them to do, which is why our schools were able to stay open for so long, because people have been doing the right thing. And I don't want to lose the essence of our conversation. The conversation tonight is not so much focused on the data as much as it is, we can get the data and make the decision and tell families, within a day or 2 days that school is going to be closed. I think the reason why we brought it to this table tonight was, if I heard you clearly, while I can certainly do that and we can continue to do that, and we can say tonight, we're going to keep schools open as long as we possibly can, and we're going to hold and make a decision at the absolute last, like when we find we just can't do it. But what I think I heard was families may need time to plan. So if in my head right now I'm thinking, hey, we might have a challenge due to, and this one is specific, due to the holiday break that may, based on the Thanksgiving break, that may cause spiking, should we let families know now, or do we wait until January 4th when we come back and we say, okay, this is where we are, and just like we did yesterday, which wasn't ideal from a family perspective, we're gonna have to close a school, the division, or whatever those decisions are.
I'm going to get right to you, but again, so that we are keeping the spirit, we had a robust discussion yesterday. Obviously, the community is observing our meeting of various technological ways, etc. So let's keep that focus as we begin to kind of see if we'll have a recommendation eventually on the floor, maybe from the superintendent, and if there's someone who would make the motion for it, you can vote it up or down, and then we can determine if there is some other option that the board would like to explore. Ms. Evans, and then...
And I will be fast. I'm just going to say again, I don't want to say the 18th. I think it is too long. I think we're not. I'd like to... I understand the parents need to know. I get that. I would be much more comfortable saying the 11th and the 4th. That gives us a week to look at all those numbers, with the expectation of, if we can't transport and if we don't have staff, that's a different story the next week if we've got to stay remote. But at least there is a chance. The goal is to have them back in school, and I hate to just say, nope, we're not going to look at it till the 18th. I think an extra week is enough time to look at that information and make a decision.
Dr. Brennan, did you want to say?
No, I didn't have any comment.
Dr. Gupta?
Today is 15th of December. So we have 16 plus 20 days, and we have been in this COVID for months now. So if you have not figured out how to do contact tracing in last 6 or 9 months, what will happen in next 16 to 20 days, then we'll start doing the contact tracing, which we have not been able to do so far. And parents That's what I'm hearing from her, that
No.
No, it's not.
Not what they're saying.
They are
No,
doing it.
our staff has been spending countless hours on contact tracing. So I don't want the public or you all, the board, to think that our staff are not doing that. We have a process currently in place, and our staff that are responsible for that are spending their entire days and sometimes into the evening, their Saturdays, their Sundays, doing contact tracing.
so how is today different from January 4th then? In terms of,
It's not different, Dr. Gupta. I think the question is this board comfortable with making a decision on January 4th that would alert parents that January 5th or maybe January 8th, we may have to close a school, a grade level, the division based on data, and that's short notice. But the other thing that this board brought to our attention is that parents would like a little bit more notice. So if we're thinking, and I am isolating this to this holiday break, I do not think we should have this conversation about every day of every week. I'm really focusing on the fact that we are about to take a holiday break, and we know it's going to be very family oriented during the holiday break. So are we at that point where we want to, sort of look ahead and be proactive, which is something we did not do in terms of forecasting going to remote for Thanksgiving, after Thanksgiving. That's really the question. It is not about the contact tracing. That's going on, and that continues to go on. It's about the notice to parents if at this point we feel as a community that the holiday may lead to some I'll say adults, because it's really the adults and the staffing pieces that might necessitate closing school, or going to remote, I should say, not closing school.
Trying to be proactive, which I think is what the board was asking yesterday. Do you feel strongly about whether that date to postpone it should be I guess we're closed on Monday. I think it's one of the things we're thinking about, right? So coming back would be on a Tuesday. So whether it would be the 12th or whether it be the 19th, do you feel strongly one way or the other as far as trying to give families enough notice that coming back on the 11th or 12th, as Ms. Evans is suggesting? What do you think about that?
I could do the 11th. I just want to be respectful of families and the board and the need for planning time, because I recognize that this is just challenging and hard on everyone. It really is. So if it's the 11th, that is a more comfortable lead time. If that's what we want to consider, I'm certainly open to doing that. We're going to monitor the data no matter what we choose. So that's not a question. It's just whether or not we want to give families some advance notice, and whether or not we think we need to take a pause because of the holiday break and shift to remote learning.
As chair, that we've given each person at this point an opportunity to share your thoughts. And Dr. Edwards, if you would be in keeping with what Dr. Brennan's inquiry to support School Board Member Evans's suggestion of January the 11th, could you advance a recommendation to us? The board can vote it up or down, and then we can have further discussion or move on to the next item, still with return to learn and play. Dr. Edwards?
Yes, so it would be, the superintendent recommends that the board approve shifting all students to remote learning phase 2 for the period of January 4th through January 8th. So that's that week, that one additional week that Ms. Evans spoke about.
We've heard the recommendation. The chair would be open to entertaining a motion. Dr. Nilles?
I move that we start school on January 4th.
All right, there is a motion on the floor, and we have to deal with that motion. It is not what Dr. Edwards presented. So is there a second to Dr. Nilles' motion?
I second it.
It has been properly seconded by Dr. Gupta that we would, January the 4th, which is technically our day off, would be the day that we would start, and the 5th, we would go right back into school. Any discussion on the motion? Dr. Nilles?
Yeah, first of all, I want to apologize for any implication that I was imputing to staff that they're behaving irresponsibly. I know everybody's working really hard, but the reality is it is incumbent on all of us to watch make sure we're social distancing and keeping the masks in, and it's easy to slack on that, but I do apologize for any implied disparagement of staff. Again, in terms of the notice to parents, I don't see January 5th or January 11th or the 18th really any different than where we are now and where we've been all along in terms of having to react, and that's what we're doing as this pandemic escalates. I think if there's a particular school that needs to shut down or go totally remote because of staff, then yeah, it's inconvenient, but at least it's just limited to a particular either class or school building. And I think I've said what I've said, my reasoning before was this, it's not, the protocols we have in place are working. A lot of it's due to the diligence of staff.
Thank you, Dr. Nilles. I would like to comment, this is just my personal thought. I did not conclude that you were impugning or anybody's
Just want to make sure. Just want to make sure.
Yes, I got you.
People
and again, we
what they
walk
want.
a very tight line, but we do want the public to know that this board is not naive to any particular thought, not suggesting that it is or is not. So I do want to say that. Any further discussion on the motion? Mr. Harvey?
Yes, I will be voting against this motion as presented. I would be in support of allowing our administration to be able to look at the data following the break, the tracing of our staff, and bringing that to the board that we could make a decision. So I would be in support of us returning to in-person learning on January 11th.
All right, further discussion? Ms. Evans?
I was just gonna say that I think that y'all are gonna need that week to look to make sure every school is covered and the number of people in quarantine. And it really is not to do with kids spread. It's to make sure that we can supervise children, get them to school, get everybody where, everybody needs to be covered. And I think that that's reasonable, and I think that that's doable.
All right, any further discussion? Dr. Nilles?
I beg the board's indulgence here. They're collecting data every day. I mean, it's not like they're going to wait till January 2nd and start collecting the data and make a decision. You're going to know whether January 5th is reasonable or not based on staff. You're not going to, it's unlikely that you're going to have a whole, and you possibly could have a whole slew of cases, right before school's supposed to open, and we'd have to react. But I think I just wanted to make that point that this data collection is ongoing, and I expect it will be ongoing through the break.
Thank you, Dr. Nilles. Ms. Evans?
I I get it, they are doing it every day, but I want to keep in mind, our teachers are on break as well during this time, this 2 weeks. It's their break as well. So they're, not that they're not contact tracing and doing all that, but I think if we were I just think it's a little bit different when teachers are off contract time and at home.
Thank you. If there's no further discussion, I'm going to ask that our clerk would please call the roll on these votes because we want to make sure that they're clear. If you are supporting the motion, which is to start on January the 4th, motion by Dr. Nilles and seconded by Dr. Gupta, you would vote yes. If you are not in support of the motion, you would vote no.
School Board Evans,
No.
School Board Member Morrison,
No.
School Board Member Dr. Carter,
No.
School Board Member Vice Chair Brennan,
No.
School Board Chair Dr. Coleman,
No.
School Board Member Dr. Nellis,
Yes.
School Board Member Dr. Sinha,
I'm going to vote yes.
School Board Member Dr. Gupta,
Yes.
School Board Member Mr. Harvey.
No.
If you could please announce the results.
6 yes, 3 no.
All right, is the,
Correction?
Six
No.
no.
Six no, 3 yes.
that is, thank you, Mr. Harvey.
Yeah.
Yes, so the motion fails. Now we are back in need of action. I repeat it one more time because I'd like for us to be clear.
6 no, 3 yes.
All right, so the motion fails. The floor is open for another motion.
So just make a motion that we start school for the second, is it second semester?
It would
at
take
that
us through January the 4th through the 8th.
point? Okay, so that we're on remote January 4th through 8th, and in-person hybrid starts again the following week. That I
That is
guess
correct, is my
Monday
understanding
the
of
11th.
what
So
recommendation.
remote for 4th through the 8th, if that's all we're voting on, that's my
Is there a
recommendation.
second to Ms.
Second.
motion? All right, Ms. Morrison, you've made so many seconds tonight. I'm going to,
I'll
Mr.
defer to Ms. Mark.
Okay, all right. Yeah,
forget
Ms.
to look
Morrison,
your way.
second. Okay, all right. Any further discussion? Dr. Gupta?
You know, I've asked previously too, we keep moving between phase 2 and phase 3. What is the plan to go to phase 4? You know, I know this is for far stretch out, but as the vaccination comes, you know, the things will calm down. As a division, we need to be prepared and ready to move in that direction.
Thank you, Dr. Gupta. And separated from Dr. Gupta's dynamics, we're trying to deal with what we can deal with and the expectations of what we can deal with right now. And so, any further discussion? Then we will call for the vote. Ms. Day?
School Board Member Evans,
Yes.
School Board Member Morrison,
Yes.
School Board Member Dr. Carter,
Yes.
School Board Vice Chair Dr. Brennan,
Yes.
School Board Chair Dr. Coleman,
Yes.
School Board Member Dr. Nellis,
No.
School Board Member Dr. Sinha,
Yes.
School Board Member Dr. Gupta,
No.
School Board Member Mr. Harvey.
Yes.
Thank you, Board, for those deliberations. Now we'll move to the next portion of this very important discussion. Dr. Edwards?
Yes, the next portion is somewhat related to what we just discussed, and is with regard to athletics and extracurricular activities. And if you recall, when we first started the pandemic, one of the most important things we also included was we did not want to lose focus on the fact that we understand that this is an important part of kids' lives, the participation in extracurricular activities and athletics. And we continue to have conversations with regard to that. But some of the same dynamics apply here as you make decisions about remote instruction, going to phase 2 with regard to the academic version. We're also looking at what happens with the athletics and the extracurricular area. And there was also some guidance from VHSL, and we know that, you know, some of the mask guidance has now been retracted, and those are local decisions. And I do know that my folks have met and continue to meet in our division to vet that guidance, which has changed rather quickly. But what we have on the table right now, as we move to phase 2, we also have phase 2 for athletics. And the athletic folks, if we ended this meeting without having some conversation about them, would be left with some questions. So the question is, what do we do with athletics during this time that we are in what would be phase 2 from up until the first week in January. Our recommendation has been to, as we shift from phase 3 to 2, that the whole division shifts from phase 3 to 2. There are mitigation protocols for athletics for phase 2, similar to there are protocols for academics in phase 2. But there are a lot of questions regarding competition and when it starts. And I'm not so sure I got the full VHSL update on where they stand with that, but those are all very timely. So I'd like us to have a discussion about that, just so I can get a sense of where the board is with regard to participation in athletics and competitions in light of what has transpired with both VHSL and the holiday break.
Dr. Edwards, if you would allow me, before we open up the discussion on this matter, I would just like to indicate that of the 318 schools that are part of VHSL, about 66%, somewhere in that range, of those schools are engaging in some form of competition. The VHSL Executive Committee did meet today, and some competition is beginning now. And so that group did not decide to shift it to January. Also, it is clear that school divisions are engaging in local choice. So that's why this is coming before us tonight. It is really a matter of local choice, what you want to do. If practices are delayed, there's the possibility of getting a waiver from VHSL regarding the reasons why you're delaying, and maybe even the possibility is up for discussion where games may be added on the back end for individuals whose seasons were delayed within this coming field of discussion. What I'd like to ask you, Dr. Edwards, is it appeared to me that some school divisions, the local health department is mandating to that school division, and some are not. Which is it here in Lynchburg?
Correct. There are health directors that are very involved with making the decision for school divisions. That is not us. Our health director works side by side with us, examines our Lynchburg specific, because remember, we're the whole Southwest, so whole Central division, but he does sit with us to look at Lynchburg specific, and we are able to bounce ideas off of him and get his guidance, but it's not as it is in other divisions where the health director makes the decision.
We're open for discussion. I do thank you for allowing me to share that as a member of the Executive Committee of Virginia High School League. It's tough. It's tough all over the state. Ms. Evans?
Well, I had a question. We've been practicing, and they've been conditioning for months. So I'm curious if we've looked at, have we had any issues with any quarantines or anything going on in the area of athletics yet? Like, what has that been?
We've had some students who had either been quarantined and in a couple cases tested positive, but that has been low incident for our teams and our athletes.
Have we talked to actually talked to the coaches and gotten how they feel about this? Do they want to be practicing? Do they not want to be practicing? I just worry, again, we finally got some of these kids engaged in something again, and to take it away worries me a great deal. I think we can't, sports are just very special for some kids, that outlet needing. I worry about everything about them if they don't have, for some, sports is what they have. So I just want to make sure, if we've been doing this and schools are closing because we are unable to supervise and get the kids to school right now because of our numbers, are they all, that's not student spread, so perhaps they can still practice. I'm not saying compete and get on a bus and go to another school, but at least have the ability to practice.
So to answer your question, it would not be Lynchburg City Schools if my teams did not get together and have recommendations. So our athletic directors, trainers, and principals at the secondary level did get together. They recognize where we are and what the concerns are. And they too are, they're in support for let us all do our parts to keep the schools open so we can give the kids a rich academic experience and also a rich athletic and extracurricular experience. And, all of us, just as much as we want to keep open schools 5 days a week, I'm sure our coaches and athletes and athletic directors want the kids to play and practice. But, that being said, they are very conscientious. They did when we were in phase 2. I'm so proud of them. They did have very good phase 2 mitigation strategies, which they followed. And I think in part, that's why we did not see a significant spread or any kind of high incidence amongst our athletes. That being said, we're still in the same zone of the holiday and the increased numbers that we're seeing, which, that goes without saying that that their coaches and the athletes are still in that mix as well. But I do have a recommendation from them. They did weigh in on what they would like to have, which of course would be to have kids continue to practice. But they also shared that they understand that if we're going to phase 2, that there is phase 2 protocols for athletics.
Ms. Morrison?
Dr. Edwards, I understand practicing and conditioning because it's a controlled environment. But the idea of competition, if we can't get our kids back in school, why in the world would we put them on a bus, send them to another school, have them engage in competition body to body and face to face, put them back on a bus with the bus driver that we're already worried about, and then send them back to school? It makes no sense to me.
And what you said is an absolute concern. And if I had my diagram from yesterday where I had the balance up, and this is one of those situations where you're looking at exactly what you said. There is the health concern right there. From a health perspective, is that the wisest choice to make for our students, especially as we consider competition. When you're looking at what they're doing in their own home in Lynchburg City Schools, it's a little bit different than when they're going to compete with others or others are coming here. So that's one side of the balance. The other side of the balance is exactly where we are in terms of just the learning piece that we know kids are suffering, that for some kids, they absolutely need this just as much as kids need in-person learning and the various effects of that. So I get a lot of emails on both sides of it that say, please, please, please do not take this away for social emotional, reasons, that it helps children. And then also please consider the extreme safety risk of having children engage in this, which is why we're here at this table with very hard decisions to make about our kids in terms of this area here.
Do we have to decide competition tonight or just practice? What are we being asked to decide?
I think as Dr. Coleman mentioned, that there are, VHSL has that kids have to have so many practice hours before they compete. So they're kind of hand in hand. And I think Dr. Coleman said there may be a waiver or some adjustment to the schedule, of which I'm less sure about how that works right now. So it's hard to separate the practice from competition, because if they don't practice, they may not be able to compete, is how it was explained to me, that they're connected together.
Further discussion? Dr. Nillis?
Yeah, I think this is an integral part of public education. It's character development, it's what engages some of the students. This is what gets them engaged for education. Our experience has been good so far. I have no reason to think it won't continue. The staff is obviously very diligent. In fact, it might not be a bad idea if the whole city of Lynchburg joined the high school teams and had to follow the protocols in terms of spread of COVID. And I think the staff has indicated that they are diligent and they care about the kids, and it may be that some of the teams have to pull back. Colleges are playing. There are other schools around the nation that are playing. So yeah, I'm definitely in favor of it, particularly with the support of the athletic staff. And this is ultimately comes down to this is the family decision and students. I'm not going to decide that for them.
All right, so board, this is again local choice. I did fail to mention that there was some misunderstanding about mask wearing, and now that is once again up to each local school division. That language was retracted, that you had to it is advised to. And even if we make a decision to require our athletes to have masks or face coverings in athletic competition, that does not mean the opponent would have to. So we've got two philosophies here. We've gone remote as it relates to in-person instruction. And then you say it is acceptable for us to have students participate in practice, and depending upon the requisites for practice, being game ready, if you will, according to VHSL, and the possibility of a waiver. And then you have those who understand some of the dynamics of kids that have been mentioned and the needs that they have to participate in this way, and how safe will they be. And we have data that suggests that they have been deporting themselves appropriately in practice. So I believe the superintendent is looking for some guidance. Dr. Edwards, did I hear a recommendation you advancing before us?
I have a point for clarification.
Yes, Ms. Morrison?
So phase 2 for athletics does not include competition.
No.
No.
Okay.
It doesn't include
Right.
practice, it includes conditioning
Okay.
and training.
Very, very true. So, Dr. Edwards? Oh, Lord, did I lose her?
Yes,
she's
sir.
there.
No, you did not lose me. I'm here. So you are correct in that the phase 2 does not include full practice. It does have, remember when we were in phase 2 for athletics, we had sort of pod work and minimal shared equipment and things that the kids could do that they could engage in, and it would just be for winter sports. So if I were to make a recommendation, and trust me, I'm extremely torn on this one myself in terms of balancing the health risks with the social emotional risks, and also understanding the work that my staff has put in place over the last, they've been practicing or been conditioning, engaging with students since July. So my recommendation would most likely be that since we are shifting our general population to phase 2, that we shift our athletics and extracurricular activities to phase 2 and allow them to still do what is in their mitigation plan for phase 2, which does include some conditioning and minimal shared equipment and pod work and things that are outlined in their athletic and extracurricular plan. And that would be for the time that we are in remote learning for the general pop.
Right now, it would only be from the 4th through the 8th into the new to the new piece. And
Well, it would cover it covers right now through the holiday break, because we're in phase 2 right now.
I stand corrected. That is correct. From right now up until January the 8th. All right?
Yes.
In the same manner, is there a motion in that regard or another motion that we would like to put on?
I'm not, what is it we're approving here? I mean,
What-
she asked for a sense of the board.
Dr. Edwards, would you like to clarify what are we approving?
Absolutely. So we just approved moving the general educational program to phase 2. And typically when the school was in phase 2 in the summer, the athletics program was also in phase 2. And then as we shifted to in-person learning phase 3, when we invited pre-K to 2 and so on and so forth, we shifted the athletic program to phase 3, and they did a little bit more than they did in phase 2. We've made a decision for at least 2 weeks, this week and the first week at school, which kind of covers even the break, to shift the general population to phase 2. And now we're making a decision on whether or not to shift the athletic and extracurricular program to phase 2 as well, recognizing that they have their own phase 2 mitigation plans for the same time period for this week, over the break, and into the first week in January up until the 8th.
Since the board is weighing in on return to learn, we're weighing in on return to play. And so that is what we're attempting to do. And again, local choice is what Virginia High School League has put out for each school division to make their own determination as to what they want to do. Is there a motion?
I'll make the motion. I think it's the kids are still engaged. They're still able to do stuff. My only question is, are the teams that condition and practice at Glass, are they only Lynchburg City Schools? Because I do know other teams who have had, like we have a different lacrosse group in Lynchburg, like a, different, I don't know what they're called.
Like a
group,
rec team?
Club, like a rec.
Yeah, like a rec
club.
team. Like, do they also practice in Lynchburg with the Lynchburg team? Okay.
To my knowledge, no. But I will certainly inquire about that. But to my knowledge, only the kids who are under our supervision are practicing or conditioning or working with our coaches for the purpose of representing us.
All right, then it has been moved by School Board Member Evans and seconded by School Board Member Carter to have the phase 2 and phase 2 mitigations, et cetera, through January the 8th. Is there any further discussion?
Just to be clear, this is moving back.
Mm-hmm.
Yes, it is in fact, it is, sir.
Okay, so, well, I guess whoever made the motion, do you want to
Yeah, the motion is on the floor. It's been seconded. Any further discussion?
comment? Okay, I'll comment. I think
Please. Yes, but go right ahead, Dr. Miller.
there have been no issues. I don't understand it at all. There's plenty of teams, non-high school teams that are out practicing. Dare you to go down to the Y in the afternoon and you'll see a relatively full pool swim team. They've been practicing a long time. Students are participating in sports by choice with the support of the families. They started in the little pods with the hope of progressing to actual competition. That's the whole point. There's been the due diligence. We've had good experience. I see no reason to back off from that. It's totally different than having the staff affected and us not being able to deliver services and having to close a school or we have transportation issues. So I don't support this at all.
Thank you, Dr. Nilis. Dr. Gupta?
To me also, it doesn't make sense to why are we stepping back? Because as I said, from my house, I can see these kids playing, and I have not seen any issues even from the administration on the athletic field. So I don't see a reason for why are we taking a step back. Step forward, I can understand there may be a list, but leave them where they are. Let them develop their talent. So who are we to dictate a family what to do and where to participate?
Dr. Sinha?
Would these students be impacted by the inavailability of a activity bus?
That's what I was getting ready to ask. That's important.
And how many would that be? And I guess it's just for that week, so, correct?
Dr. Edwards?
Yes, I'm sorry. Yes, we are, this week we're on pause because we don't have the capacity to do that. And then we're on holiday break. So we're really looking at the week of the first week in January 4th to being, looking at that in terms of their ability to continue with their phase 2 plans. And I don't know what the competition schedule is going to look like, as it is a local decision. And I know that our athletic directors are working together with all of them in the Seminole division to try to make a more division-like decision. And we do know that some of the folks that we already know of some teams that are already quarantined because of some COVID issues. So I know that they're working to try to make the best of this bad COVID area and make a good decision across all of the Seminole district.
Thank you very much. Ms. Evans, do you have another thought?
I just have a question. You said this is for this week and the next week, but there were teams set to practice over Christmas break. Where do they fall into this? If you're saying we're just talking about that 1 week, we're really talking about more than one.
Well, in terms of the holiday, I'm sorry, in terms of the, when we're back in session and if there's competition that's going on and requiring that, that's what I was referencing. In terms of the teams that was set to practice over holiday break, they can do their phase 2 protocols that they've had over, if we're agreeing that they can stay in phase 2, they can continue in phase 2 over the holiday break. Because technically we're in phase 2 right now, so that wouldn't be any different for them to continue being in phase 2.
I said, James, what I said, the motion I put up.
You want to withdraw your motion?
I do. All right.
The motion had a second. Now, there is a motion to withdraw,
Sorry.
and she has the right to withdraw her motion.
Sorry. It just, after listening to it, it doesn't sound like we're going to be, it doesn't involve any buses. It doesn't involve anything that was our concern right now, and the reason why we have gone to remote learning, which was, personnel being stretched to the limit, the transportation being stretched to the limit, not knowing what teachers are on quarantine, and I get all that, and that is real, and it is hard, and we're dealing with it. But if we're talking about practices that kids get themselves to, and there has not been problems with this, I think they should be able to do it.
School board member Evans, you have the right to withdraw a motion, and it would require a second.
It requires what?
It would require a second to your motion to withdraw.
I'll second.
Thank you.
All right, and if there's no objection, the motion will be withdrawn. Now we need,
You have a,
are you objecting, Mr. Harvey? Please, go right ahead. You're
I would like to
recognized.
make a motion that we support Dr. Edwards' recommendation.
Second.
All right, it's been moved by School Board Member Harvey, seconded by Dr. Carter, that we would embrace the same motion that was before us before it was withdrawn, and that can be done as well. So now we're back into discussion on the same motion. Motioned and seconded by Harvey and Carter. Dr. Brennan.
Just a point of clarification, because I have trouble following the different phases. So if we stay where we are now, do the teams compete with other teams?
Yes,
do.
if we stay in phase 3, competition is allowed in phase 3. If we go to phase 2, where we were, our internal teams can still condition and do small group work.
All right, Mr. Harvey.
I was in support of Ms. Evans' original motion, and the reason why I supported that motion again is because I believe we need to be consistent. We're telling our community that we believe that our learners need to go back into phase 2, and so I believe we should be doing the same with our athletics and extracurricular activities as well.
Any further discussion on the motion, Dr. Nilles?
I guess as a point of clarification, I believe the reason we're having our learners go back late is so there's convenience for the parents, which really is not relevant to this discussion about sports.
All right, Dr. Carter?
And I know that we've seen where the young player collapsed on the basketball court. In some of these sports, I just question how they can play them being that close in proximity without a mask, and you really can't wear one with all the perspiration. And but I think that for the safety of the students, they weren't in competition prior to this. Were any people, and that's the problem, is the competition versus the conditioning. And I know that sports is really integral to some students, so is learning. So is music, so is band and choir and all of those. And if we open the door here, then we might as well go back and open the door for everything else, because everything has a risk. But the sports, especially wrestling, I mean, how can you do that with this?
Dr. Sinha?
So will you clarify for me, we're discussing essentially the difference between one phase that allows competition, which they're in now, and dialing it back to one where they can practice and condition or whatever with mitigating measures, but not have competition.
That is correct.
Not a normal
It's
practice.
not a normal practice.
Okay.
Right now, competition has not started. Practice started this week, last week, but competition has not started. But in phase 2, it would go back to some pod work, some conditioning, some limited sharing of equipment, but there wouldn't be a full-on practice, and there wouldn't be competition.
Go ahead, Dr. Sinha, stay with you.
What I was, the second part of my clarification is when does competition actually start? Are there any games or competitions
And I want
in
to
that
clarify, that's
first
an
week back?
excellent question, Dr. Sinha, for us, because competition, VHSL-wise, has started. But again, it's local choice, and some divisions are delaying, and we haven't had anybody to suggest this. Some have just straight out shut down the athletics completely. Dr. Edwards, do you have any idea when the first scheduled competition is for any of our sports that are this December season?
I believe we were supposed to start in December 21st, but like I said, I do think that our group, and I'm just looking at my notes from my team, are recommending that they hold off on competitions until like January 4th, so that, and they're probably doing exactly what we're doing, looking at contact tracing data and seeing what has transpired over the holiday break. But you are absolutely right. Each division can make its own decision, and we're at least trying to work together with the divisions that we compete with, because one division can make a decision and another division could just be out. And we've seen some of that with some of the people that we compete against in Bedford County.
And no school is being penalized by Virginia High School League for non-participation or delay. Dr. Sinha?
Okay, so related to that, we know we have a serious transportation constraint across the board. We started the school year with that constraint. So what is our capacity to transport students to off-site competition, away games, if you will?
So we've had this conversation with our transportation folks and our athletic folks, and we sort of prioritize how transportation goes. So when we're in school, in-person learning, drop off and pick up is primary. And then we had a stepwise approach to high school competition, varsity, working our way all the way down to middle school activity bus. So if we needed to scale away, or we needed to pull a bus for, to do a regular pickup and drop off for a student, it would start with the middle school activity bus and work its way up the chain. But there is a protocol and a hierarchy with regard to busing.
Still have a motion on the floor. Any further discussion? Ms. Evans?
I do have a question. So the minute that we go back the 11th, phase 3 sports would be reintroduced, or we'd have to meet again and change? Because if they're just going back to practice the 11th, your competition is way off. I mean, you know what I mean? Like, you're kind of starting over again if we haven't practiced since this week. So I think you got to keep that in mind. I just worry about, I'm not worried about competition. Nobody is competing right now. Nobody's having games right now. Nobody's getting on a bus and traveling. It's practice. That's why I asked, do we have to deal with the games and practice? Can we just look at one of them? I don't think we should be going to games either right now, but I do think that they've done such a great job in practice, they should be able to do that. So I'm torn on what to do.
So with regard to your first question about the voting, so we're trying to make our default the hybrid model. Phase 3 is our default. And then we take a vote to temporarily shift as needed to phase 2. And then when that concern is over, we go right back to phase 3. So we don't have to come back and say, can we vote to go back to phase 3? We're really only looking at these votes that we've had to be temporary shifts in response to a COVID related concern that comes up. But once that concern is gone, and that whatever that time frame is, we automatically default back to phase 3 for academics, so in-person instruction, and phase 3 for athletics, if that's the route that the board goes.
To keep in mind that a winter season is so short, and you're talking now until the 11th before you can have a normal practice again. And for a season sport, that's a pretty big deal. So I just want to make sure we're looking at everything and not worrying about games that we're not even going to right now. Like, if we're not going to those games, do we have to keep kids from practicing? That's where I'm having a hard time. Does it have to be one or the, like, do we have to, why can't we just say, we are not participating in games? Mm-hmm. Why can't we just say that? And then the teams can continue doing what they're doing. We're not having spread among the teams the way the coaches have been doing it. So I think that's where I'm just struggling to say, nope, you got to go back to phase 2, when we could have just said, you can't try, you're not having games, but you're allowed to keep practicing. Because as Mike said, the problem was our staffing and our buses and our people, not how they were doing their mitigation strategies to me.
Very good, Ms. Evans. First of all, Dr. Gupta, before I get to you, Mr. Harvey, did you have something that you wanted to say a minute ago?
No, I mean, the motion's on the floor.
The motion is on the floor.
And I believe that we need to remain consistent. When we're talking about athletics, we're talking about many of our coaches are our teachers. Many of our athletes, in fact, all of our athletes are our learners. So what is different with our athletics versus our education? That's where I feel that the motion encourages us to be consistent with our regard to safety of our learners and our staff.
Thank you, Mr. Harvey. Dr. Gupta?
So Dr. Edwards, have you heard any issues from your coaches for you to recommend taking a step back?
I'm sorry, could you repeat that?
Have you heard any issues from your coaches in terms of athletes not following the recommended protocols while training for you to recommend taking a step back for a week?
No, this is not based on the athletes not doing what they're supposed to do, nor is it, the other decision based on staff not doing what they're supposed to do. I think to Mr. Harvey's point, and for the community that is listening, and I think we're having a very positive and very fruitful discussion about, the dynamics of where we are. So that is basically where we are. If we're shifting back into phase 2 for this short period of time for academics, we needed to have the conversation about athletics. So it's not as a result of any athlete not following protocols.
This meeting has been broadcast through our television mediums and other mediums. Nothing that we do here in Lynchburg City Schools with the school board is done in a corner unless it's in a closed meeting. And so we've had a robust discussion. I will be supporting this motion from Mr. Harvey for the reasons that have been stated of consistency. I do not want to come across as one who is weighing my decision based upon other entities. I just have been in several conversations, listening to both sides of the arguments all over the Commonwealth. And I believe that it is wise for us to embrace the motion that is on the floor. That's what I will be doing. And so if there's no further discussion on this matter, I'm going to ask that the clerk would please call the roll. If you, Dr. Nilles, please.
I have a question. What games are scheduled right now?
Say that again so she can
What
hear.
games are scheduled right now?
The question is, what games are scheduled right now, Dr. Edwards?
For us, we don't have games scheduled right now. So
Thank you.
we were
Roughly how long would
scheduled
that
to-
take? How long would
I'm
that
sorry.
take to start scheduling some games?
I would have to defer to the athletic directors and in the division, in the district, because they would have to schedule games with each other, other teams, other areas. So, and I know, like I said, they were making a recommendation to possibly delay any contest until after the new year.
To stay with practice and delay actual competition games until the new year.
That's what I have for a recommendation. Now, whether or not that has been approved by everybody in the Seminole Division District, that I do not know. But again, just talking with my folks to get a sense of, give me some input, give me a recommendation.
I have one more question. I believe there's been a good collaboration among the neighboring divisions in the Seminole District in terms of the protocols and all that. Is that?
Yes, the superintendents, we met together and we all feel strongly that we need to support one another. I mean, it wouldn't look too good if one division is competing and the rest of us aren't, then the kids don't have anyone to compete against, and vice versa. So we have been working together. We did ask the principals to get together. We've asked the athletic directors to get together. Our athletic trainers and coaches have also weighed in. So and I'm again really proud of the collaborative work that they've done to try to, include some opportunities for kids. They recognize we're in a shortened window and it's a tough decision, but they have been collaborating.
Based on that, my opinion is the neighboring divisions are following similar protocols, and so when there is actual competition, it's not like we're throwing our kids out into the wild with some uncontrolled rabid horde.
I'm not clear on what you just said, Dr. Miller.
I think the division's experience with the protocols has been good. There's not been transmission, just to say it can't happen, but everybody's been very diligent, and I think competition among the Seminole District schools that have been cooperating and collaborating on similar protocols, I think that's very reasonable and prudent. I don't see a tie between, in-school learning and the competition. The resource allocations are different. Kids have to go to school. Kids don't have to participate in sports and athletics. So in terms of I think any tie there between the two is, I think, arbitrary. So I do not support rolling back.
Yes, sir.
Competition at all.
Thank you, Dr. Nilles. Mr. Harvey, and then we'll ask for the roll call.
I respectfully call for the vote.
Yes, Ms. Day, you've been voting.
We read what the vote is going to be.
Yes. Dr. Edwards, one more time, reiterate well, Mr. Harvey made the motion.
Yes.
Yeah, I made the motion that we return to phase 2 for athletics for the same period in which we are returning to phase 2 with our return to learn. So our return to play is consistent with our return to learn.
With their own set of mitigation plans. All right, the motion is clear and it was seconded. Call the roll. If you're in favor of the motion, state yes. If you're not, no or nay, however you choose.
School Board Member Evans,
No.
School Board Member Morrison,
Yes.
School Board Member Dr. Carter,
Yes.
School Board Vice Chair Dr. Brennan,
Yes?
School Board Chair Dr. Coleman,
Yes.
School Board Member Dr. Nellis,
No.
School Board Member Dr. Sinha,
No.
School Board Member Dr. Gupta,
No.
School Board Member Mr. Harvey.
Yes.
All right. Could you announce the result of that, please?
5 yes and 4 no.
Thank you so much. The motion carries. All right, thank you so much. Dr. Edwards, I believe you have exhausted the thoughts for that section of the agenda. Is that correct?
Yes, sir, you are correct.
Give Jen Armstrong and all of the others who work so diligently our regards. This is a tough matter, and I know I'm proud of our school division that we're not amongst those who have voted to deny athletics in the midst of this pandemic, and hopefully we can govern ourselves accordingly. Thank you so kindly. We will now move to the next item in our agenda, which is we are wanting to state this. The SEAC presentation is very important on our agenda for E4, but we're postponing that, recognizing, so we will hear that, as well as the Human Resource Department presentation. Those are being postponed, and we will bring those back, of course, at the will of the board with agenda approval. All right, we will now move to the next item, F1, informational items. Mr. Harvey, correct me if I'm wrong, the next Finance Committee meeting is scheduled on Tuesday, January the 5th, 2021 at 3:30 p.m. And in light of what we've discussed earlier, that will be a Zoom virtual meeting with the appropriate notification. 2, the next school board meeting will be held Tuesday, January the 12th, 2021 at 5 p.m. And at the present, that board meeting will take place in the administration building. F3, the next school board work session meeting will be held on Tuesday, January the 19th, 2021, and at present at 5 p.m. that will take place here in the administrative building. And so those are informational items that we have at this time. Item G1, any additional items or comments that need to be made tonight prior to our adjournment? All right, hearing none, is there a motion to adjourn?
I move that we adjourn.
Is there a second?
Second.
All right, moved by Dr. Carter, seconded by Ms. Morrison. If there's no objection, we adjourn. Thank you.